Studies show 50 to 75% of long COVID patients recover, and vaccines help. But the latest StatsCan data reveal some bad news.
I live in Quebec City,
Matlin, British Columbia,
Moose Jaw, Saskatchewan.
As of last June, over 2 million Canadians reported they were still experiencing long COVID symptoms. And yet, without warning, provincial funding for long COVID clinics is drying up.
I've had memory loss.
We asked patients across the country what they're dealing with.
I have trouble breathing.
I suffer from nausea daily.
it ripped my gallbladder.
My life has been in complete chaos.
Doctors treating long COVID patients say too many are being ignored.
Their experiences aren't being validated with long COVID and are often told that this is all just in your head.
It's like aging 50 years in the span of a few weeks.
Marchell asked us not to use his last name. A COVID infection 2 years ago left him with lung damage, fatigue, and brain fog.
Right here.
He recently received a letter saying a local post-COVID rehab program is closing effective immediately,
We regret to inform you.
directing him to the World Health Organization and other websites.
I was looking for someone to figure this out with instead of trying to figure it out myself.
When it comes to long COVID, I suffered from it myself for 18 months.
Manali Mukherjee studies long COVID, searching for differences in patients who ended up with the condition and those who recovered. A newly published study and commentary found abnormalities in patients with long COVID, including immune damage or changes in blood protein levels linked to prolonged inflammation. Mukherjee says those findings, along with others, could ultimately lead to tests and treatments for the condition. Her message to patients?
Have faith. The medical community is working on it. The scientific community is working on it.
Patients desperately want hope, but many worry as memories of the pandemic fade, they will be forgotten. Christine Birak, CBC News, Toronto.